Dr. Jen, thank you for joining me.
Yeah,
I'm
thank
so
you.
glad to have you here.
Me too. Happy to be here.
This is like going to be so cool because this is such a topic that I find can be just so polarizing for so many people. When I first announced on Twitter that I had gone through and done ketamine therapy, I got druggy, I got all this like hate. I got some people saying, congrats, it's awesome, glad you treated yourself. I got other people that reached out to me and said, hey, I did it too. It was life-changing for me. But before we get into that, there's so much to talk about. I think the most important thing is that, as I've been following these trends, and thankfully do a lot to, Tim Ferriss's involvement in psychedelics and trying to push that forward. I believe I first heard about ketamine treatment via him, probably 6 years ago or something like that. And at that point in time, when I was in Portland, these were a lot of kind of fly-by-night operations. It seems like they were just propped up. You didn't talk about it. But I think the first thing, before we get into this conversation, what I loved about finding you was that you're a legit doctor. So you go by Dr. Jen, which is super awesome because it feels more approachable, but it's actually Dr. Jennifer Ellice. You are board certified in emergency medicine based in Los Angeles. You studied at Princeton University, University of Rochester School of Medicine, and the Warren Alpert Medical School of Brown University residency program in emergency medicine. It's a mouthful.
Yes.
Before coming to Los Angeles, where you've been practicing since 2008, which has gained a lot of extensive experience in emergency medicine. Those are some legit places to study.
Right, yes.
It's not like you just phoned it in on your MD. So emergency room, are you still practicing?
I occasionally do still practice, yes.
So you're seeing all kinds of different stuff.
Yeah.
Prior to starting this clinic, was that your full-time job, was emergency room medicine? Okay. So you've seen the craziest of the crazy.
Yeah, I guess you could say that. The thing about emergency medicine is it's the first 30 minutes of everything. That's what everyone says. So it's kind of, it's banal things like colds, but it's also everybody's crisis, worst day, life and death kind of situation. Yeah. So yes, I guess you could say that.
So, you've seen overdoses, I take it, of various compounds.
Oh, yeah.
Everything from broken limbs to probably people that have died in front of you. Is that fair to say?
Unfortunately.
So when did ketamine hit your radar? Was that part of medical school? And then I'm really curious how that makes its way into the emergency room.
Okay, so it's really interesting, actually, because ketamine's been in use since the 1970s as an anesthetic.
Yes.
Widely used, most widely used anesthetic on the planet.
In humans?
In humans and in animals, yes.
Because so many people, the first thing, at least back in the day, and this maybe 5-6 years ago, people were like, oh, that's horse tranquilizer.
Yeah, and I always tell people, look, my cat takes amoxicillin sometimes.
Yeah.
There's crossovers
of course.
in medicine, but yes.
Yeah, my dog takes gabapentin to relax. And stuff, and they give that to humans for the same thing.
Right. There's dogs on Prozac, right? It doesn't mean the Prozac works any less efficiently in humans or anything like that. So I like to sort of debunk that. It's a human drug.
Yes.
We use it for humans.
Yeah, because it sounds like, when you first hear that, you're like, oh, okay, so somebody went online, they found a vet, they ordered some horse tranquilizer, and now they're taking that. And you're like, you know what I mean? Like that can be a real narrative.
Terrifying.
It sounds terrifying.
Right. And how I usually explain it to folks is that I trained in this medicine 20 years ago to use in children. So the emergency medicine residency program I went to was longer than a lot of emergency medicine programs. It was 4 years instead of 3. And one of the reasons it was longer is because we spent so much time learning on children, which is important because children's physiology is very different from adult physiology. And so the way I learned to use ketamine was as an anesthetic for children. When kids have an emergency, if they break their leg or they need emergency sedation, this is a very, very safe drug to use for children.
So is that the go-to these days still?
Usually is, yeah. It usually, especially for children, yeah, because it's so safe. So that's how I train on it. But now, having said that, I've used it in toddlers all the way up to people in their 90s. So it's a safe medication for use in the ER. And just to be clear, that's not how we use it in clinics. The doses in the ER are much higher. Yeah,
very, very excited to dive into that. But like when you're talking about the ER in sedation, what are your options? Somebody comes in, they broke their leg, let's just say it's pretty hardcore, compound fracture or something that needs to be Well, that would require surgery, right? So you're probably going somewhere else there. Or maybe they pop the hip out or something.
Whether you need surgery or not, they do use ketamine for anesthesia in surgery sometimes. We use ketamine sometimes to put people in a coma if we're going to intubate them and keep them in a medical coma. So anesthetics come in lots of different flavors, lots of different doses. We mix them, and ketamine is generally used, though, for what we would call moderate sedation. Okay, so which isn't the same thing as general, just in case people are wondering. But any medication, any anesthetic, if you turn it up enough, can knock you out, right? So
when you turn up ketamine to the highest level, one of the things is you're going to become unconscious, right? You lose consciousness. Mm-hmm. But unlike other things, so let's take Michael Jackson, for example.
Propofol.
He died, propofol, right?
Yeah, milk of amnesia. That's what we call that.
Milk of amnesia.
Yes, because it's white and cloudy, yes.
So I had that done. I'm at the age now where they had to do a colonoscopy to check for cancer and polyps and stuff. And they gave me propofol as I was going in.
Yes.
And I asked the anesthesiologist, I asked for what I call, this is so stupid, I'm telling this, but I asked her what I call the slow ramp, which is where I said, hey, don't give it to me all at once. Like kind of like slow me into it. Because I'm just like personally curious about like what Michael Jackson felt when he was there, right? Because they kept him in a somewhat conscious state, I have to imagine.
Propofol is different. Propofol is very on off. Yeah, you turn it, it's, you're counting back 10, 9, 8, and then you wake up from your surgery, right?
Yeah, so when they were pushing it in, I got this euphoria of like, I didn't care if I died or not. Like it was a very euphoric thing. And I was like, oh, maybe that's why he got addicted to that.
It's also possible they were using other agents with propofol. Because usually we give something first. So your euphoria was probably not from the propofol. It was probably from midazolam or Versed. But we could kind of get into that. But basically, like anesthetics, ketamine is so safe because unlike most other anesthetics, it doesn't depress your heart rate or your respirations or your blood pressure at the right doses, right? So initially speaking, when you give anyone an anesthetic, usually their blood pressure and their heart rate will drop. And that's actually, blood pressure dropping is way more dangerous in generally speaking, than blood pressure being too high.
Right.
But ketamine's different. So when you give someone ketamine, their blood pressure, most people's blood pressure and heart rate will actually go up.
Oh, interesting.
But when you give enough ketamine, enough of any sedative or anesthetic, you will stop breathing.
Oh, interesting.
Any, right.
Okay.
The thing is that for ketamine, it's very transient. It's a very on-off. Once we turn off the medication, it's leaving your system very quickly.
Right, it has like a 3 or 4 hour half-life, is that something like
that? It does. But for practically speaking, for an emergency situation, if I can't figure out if you've eaten or not, if it's an emergency and I need to sedate you right away, I can give you this, and if something's going wrong, I can turn it off and you will very rapidly come back. So it's safe in that way, because if you stop breathing, and I have seen some providers, I've never done this, but in the emergency room, you can give ketamine too quickly. And I've seen a couple providers where a person will stop breathing.
Oh, interesting.
And yes, but it's transient. It will go away, and it's your heart stops when it happens, but they will start breathing again once you turn the medication
on. But that so just so we don't freak people out. So compare that dose of what you would have to give to get people to stop breathing on ketamine with what you would give someone in a clinic that is treating depression, anxiety, all the things that we'll get into.
Right.
Is it 10x? Is it 3x? Is it what?
For IV, it's about 4x.
4x,
but it's not really, and this is why it's so complex, and this is why providers who use ketamine should be people who are very qualified in resuscitation and airway management. Because when you're dealing with anesthetics, it's not just about the dose, it's about the rate that you're giving it, how quickly you're giving it, and also recognizing the different medical things that can make someone, say, more compromised on a certain medication. So it's a complex thing, but generally speaking, yes, it's a much lower dose that we're giving in clinics.
Right. Yeah. So, I mean, the odds of I'm sure you've treated hundreds of patients. Have you ever seen depressed breathing or anything like that? I mean, not at these levels, though.
No. So in the clinic, no, absolutely. And there's been, to my knowledge, no case reports of any bad outcomes in clinics so far.
Right.
In the United States. I mean, one of the reasons we use this medication, like I said, is because it's so rapid on and rapid off, right? And we talk about half-life, but people don't think in terms of half-lives.
Right.
What this means is I turn this medicine off, and 20 minutes later, you're coming back. You're back. Right. You're not slurring your speech. You're not, right?
Maybe a little like funky.
A little funky, but not right. And as the hours go by, every hour you're kind of clearer and clearer. So, and when I was using ketamine in the emergency room, and by the way, so I was using ketamine for 20 years in the emergency room before I ever heard about using it for mood protocol. I loved using it so much because I sort of, even without knowing any of the literature, I would see people instantly transformed after one dose. I loved it so much. This is kind of a funny story that I used to sort of volunteer to do it for other doctors, because it's a little bit more work. When you're setting up for anesthesia, you have to set the bone and you have to do the anesthesia in the ER. So it's more work to do the anesthesia part. But people would know, they would come to me. They'd be like, oh, are you going to ketamine someone? Jen loves doing it. Go.
Oh, that's amazing.
Go grab her, the other doctors. Or if a doctor had a problem, the nurse would come get me and say, they're kind of not sure how to use this or whatever. Can you come help them?
Because you see them just smile, relax? Like, what would you see?
So before I knew anything about mood protocol, I would see the craziest things. So I tell this story just because it was the first time I really started to think about this medication as something special. I had this older Indian woman come in. And she had her daughter with her who was translating. I can't remember. I think she dislocated her hip.
When you say older, you 70s, 80s?
Yeah, maybe like 70s.
Okay.
And she had the kind of face that I would only describe it as like she'd been frowning for decades. Mm-hmm. Like a really weathered. She was just like sad and concerned and anxious and holding on like this for decades. And you could see it like written into her face. Her mouth was like in a perma frown and concern. And she had her daughter with her. Her daughter was translating. And so whenever anyone's translating for a patient, you're always worried that it's not going to get fully across. So I was explaining to her, we're going to give you this medication. We're going to reset your hip. Might make you feel a little strange. We gave it to her. She woke up. And I remember being at her bedside and her face looked different. I was checking the chart, like, am I in the right room? She looked like a different person. The facial muscles that she was using were different. In psychiatry, we would say when someone's depressed, they have blunted faces, meaning they're not using even all of their facial muscles. They're not making all the expressions. They don't have the full range. She had a blunted faces going in. Coming out, she looked like a different human being. And I came to the bedside to say, are you okay? How did that go once she'd recovered? And the daughter said, she wants to tell you, life is a circus. And I was like, I thought there was a translation issue. I was like, I'm sorry, what? She said, no, she's adamant. She's really insistent. Life is a circus. And she's so happy for you. Thank you for giving her that awareness. And so I was sort of like,
wow, I'm like literally getting goosebumps.
Yeah. And her face looked totally different. And the daughter looked mystified. She was just like, I don't know what mom's on about.
Yeah.
And mom, this woman, not a woman who'd done any recreational drugs in her life or anything. Yeah. She's smiling at me and she just said like, it's all so important and it's not important. And thank you. Like I see it now. And I see that life is a beautiful circus. And I remember walking away from that thinking, well, that's interesting because people say all kinds of things all the time right after coming out of anesthesia, but something about the way her face was transformed, it really kind of stuck in my head. And I started paying attention and I would do, I use ketamine a lot in the ER. There are a lot of procedures for which we use that for. And I would almost always see some kind of dramatic transformation, even in kids. And so I started just enjoying doing it. Like in terms of medicine, I just would love it. And so I would just
giving a gift every time you go down and do it.
People would be about to use propofol. I'd be like, you want to use ketamine instead? They'd be like, why? I'm like, I'll do it for you. Okay. The orthopedist would get so mad at me. They'd be like, nah, we prefer propofol. I'm like, nah, let's do ketamine instead. Because it
doesn't propofol have a much tighter range too? Isn't it more dangerous in terms of like?
It's more dangerous because you can get to a deeper level of sedation if you don't know what you're doing. Yeah. In that sense. But anyway, regardless, so I didn't even know anything really about mood protocol. It's not something that would be on my radar as an ER doctor, even if reviewing the literature, the psychiatric stuff.
Mood protocol, what does that mean?
So in the 1990s, they started doing sort of research on ketamine and its effects. And they started seeing in the late 90s and throughout the 2000s that it has a very rapid and sometimes long-lasting antidepressant effect. Mm-hmm. And a rapid anxiolytic effect, breaking down anxiety. And so they started studying it, and they found that this is one of the few medications we have that we never say cure, but can have a long-term remission for people who are depressed, especially people who are suicidal or people with what we call treatment-resistant depression, which is a whole discussion in and of itself. But so I just wasn't aware of this literature because I'm not a psychiatrist, right? I'm an ER doctor. And I went to a party. A friend of mine was having a bar mitzvah up in Toronto where they do a lot of psychedelic, because there are looser restrictions on psychedelic research and on psychedelic use. You can invest in, I guess, psychedelics, marijuana on the Canadian Stock Exchange. So there's a lot of finance up there for psychedelic research. And I happened to be standing next to a finance bro at a party. And he was the CEO of a company that was rapidly buying up ketamine clinics across Canada and North America and the United States. And I knew nothing about this. And so he said, oh yeah, do you hear about this? This is what I do. And I said, no, what are you using? What do you mean? What, ketamine clinics? What are you using it for? And he said, oh, for depression. You never heard of this? And so I was like, no, I haven't. I went
You're
and
like, but I've seen it.
I've seen it, right? I was really intrigued. So I went home and I did a deep dive and I looked through all the literature and I was really, first of all, blown away that I'd never heard of it. That was weird to me because the literature is solid. I mean, there's, stuff out there that we do in medicine that doesn't have great evidence, but this was like really high quality, evidence-based research across the world, replicatable, clinically controlled, clinical trials that were, randomized controlled trials that showed again and again this rapid antidepressant effect. And I think for me, I actually went to med school to be a psychiatrist.
Oh, interesting.
Yeah.
Okay, that explains a lot. So this is checking more boxes for you.
Yeah. And during med school, during our rotations, I just got really frustrated when it came to psychiatry. I didn't think that what we had to offer was really that great. I mean, I'm not poo-pooing SSRIs, I'm not poo-pooing therapy, but it was really heartbreaking to see people not being helped by my profession, from what we had. It just... So I didn't go into it because it didn't seem like, something that would be fulfilling. And so when this came around, I was like, wait, there's something here now that can actually help. I kind of just, it checked that box for me, but it also after COVID gave me an ability to kind of reconnect with medicine and why I went into it.
What's interesting when you said about SSRI is the one unique piece about ketamine that I think is so fascinating is, oftentimes when people have to change modalities for depression, it's like tapering off of an SSRI to try something else, right? And correct me if I'm wrong here, but you don't have to taper off an SSRI.
No.
Like, these are completely compatible. You can try them in conjunction with what you're already doing.
And not only that, most of the studies were done on treatment-resistant depression, patients who were on SSRIs, sometimes multiple SSRIs.
Interesting.
So we actually don't recommend tapering while you're getting your infusions. We recommend if you're going to taper, to either do it before or after in conjunction with your psychiatrist, but you definitely don't have to. They work completely different ways. So yeah.
Is there any drugs that people will be on and they can't receive this treatment because they're taking something?
There is, if you're on MAOI inhibitors, there's a relative contraindication there. You kind of have to think about it. And then there are some conditions. See, because ketamine raises your blood pressure and your heart rate, if you have a really bad heart or if you have an irregular heart rhythm or something like that, then you want to use caution. Make sure it's part of the reason why this is a medicine that you should be administered by a doctor and not in a recreational setting, and why you should have a doctor look over your medical history before you begin. Yes, and there's some medicines that we think might dampen the effect of ketamine, so we will recommend if you are on them and you actually absolutely have to be on them that you kind of push your dose out
what would that be?
Away. Some mood stabilizers like Lamictal, some benzodiazepines like Ativan or Valium, Xanax, that kind of thing. So
interesting. Okay, so. And that explains why you have such a rigorous kind of intake form. And you personally interview every single person before, which must be a lot of work, but you actually have a conversation with these people to make sure they're a good candidate before they can just come in and take the treatment. So let's talk about, there are so many different ways that one can do this. I mean, there's some places that are like now mailing you ketamine in the mail to do, kind of guided therapy. Right. There's street usage. Can you walk me through how does this get into the humans' bodies?
Okay. Well, first of all, it can be introduced into your bloodstream directly, and that's IV. Okay, so that's the most effective way to get it in your bloodstream. But once it's in your bloodstream, it has to cross the blood-brain barrier to get to your brain where it acts. So there are multiple ways to get it into your bloodstream. So you can do an IV or you can do an intramuscular injection, which is like a step down from IV, where the medicine is injected like a shot. So it looks like a vaccine and it goes into your muscle and then it's released slowly from your muscle. There it goes through your bloodstream and crosses the blood-brain barrier.
Right.
And you can snort it like a powder. You can spray it into your nostrils. You can take it into your mouth and swallow it and it goes into your stomach, or you can swish it around in your mouth and then it'll cross the mucous membrane in your mouth. People also do swish it and put it in their butts. Yeah. There are lots of different ways, right?
Yeah. Do that with cocaine too.
Yes,
There's lots of...
And that's because the mucous membrane in your gastrointestinal system is very rapid transfuser. So you can get medications across that barrier and into your bloodstream very quickly. But what happens right away is that your liver is rapidly metabolizing the ketamine, right? So when you drink alcohol, this happens too, right? Your liver will break down the medicine into a secondary, tertiary, and sometimes quaternary metabolite. So with ketamine, it's super efficient. It's so efficient at pulling it out of your bloodstream that it is not recommended that you swallow it. And so people who are taking lozenges for therapy, they're recommended to swish it around and not swallow it, because as soon as you swallow it, it goes through what we call first pass hepatic metabolism. Your liver just pulls it all out and turns it into norketamine, okay, which is a secondary metabolite that doesn't have those effects on your brain, okay? When you take it, there are efficient ways to get it across the blood-brain barrier, and there are less efficient ways to get it. And by the way, when you're taking it orally, you have to use much, much higher doses of ketamine in order to get enough to cross the blood-brain barrier. And when you do, you produce much, much higher amounts of norketamine too, which is toxic in and of itself, right? So just to be clear, there are, and this is true, this is the pharmacokinetics of any medication you're giving, there are ways to do it that are more efficient than other ways to do it. And so the IV administration is the most efficient way to get this medicine across the blood-brain barrier where it's working. And when you use it in other ways, the absorption across the blood-brain barrier is more variable. So it instead of looking like this, with IV, you're getting like spikes.
Okay.
And so, that has effects on the trip, but it also has effects on its utility. So when you look at studies, you see that you get the best results when you do an IV infusion.
When we first met and you helped me, we can get into that experience, you said to me, it's about time on brain. Can you explain what that means? Because that would explain some of the spikiness and why that's not ideal.
Right. So we think we know how this medication works, right? There's sort of two ways that it works. One is the neuroplasticity that you get, and we can kind of get into that, and we should. I think people should understand that. And then the other is the trip itself, and that's a little bit more of a black box, but we know that's also important, right? So time on brain means this medication needs to cross the blood-brain barrier and act on your brain. And we know from the studies that the time that it acts on your brain, the length of the time that it's there, is more effective if you can get at least a 40-minute infusion where that's the amount of time that your brain is under the influence of this medication.
Okay, so just to break that down for people, someone's laying there in your clinic, they have done an IV, you have an IV. The IV is, it's unlike a traditional bag IV that you would see, for someone getting like saline solution or something, right? You have like a syringe that's sitting inside of an automated machine that's been pre-programmed to automatically, so it's not like someone coming in there and just choosing how much they want to do. It slowly and via its programming pushes that into them over the course of an hour. So you're guaranteeing consistency.
Correct.
Which is amazing.
Right.
And then that's going straight in the bloodstream, crosses the blood-brain barrier. It's sitting, that ketamine is circulating in the brain, and then that's when you're getting the beneficial effects during that time.
Correct.
And so because you're doing that nice programmed, automated dispersal of ketamine, you're getting the most benefit for bang for your buck in that.
Correct. Just to be clear though, I do it with the machines because I am a very precise person and I like that. But many clinics just put it in a bag. Like what you're talking about. You can't control the rate of a drip in a bag. It's just less precise. You just sort of judge eyeball. Oh, that's how many drops per minute. Yeah, but also,
correct me if I'm wrong here, but for me, I'm thinking like you're in there, you're sitting down for an hour and a half before you actually want to get up and kind of like walk about, and you're a little unstable. If I'm getting a bag of saline with my ketamine and I have to pee, I mean, this is a little logistical challenge,
No,
right?
It is, right. Yeah, and so they would use maybe a smaller bag, but yes, it is a logistical challenge, correct. And so the benefit also of having a machine is that you can deliver the smallest amount of volume.
Oh, I see. Okay.
Right.
And then how do people think about, or how do you as a physician think about the difference between the two most common, the two used in your clinic, which is intramuscular versus actual IV? Like when is one better for a situation? Is it just some people don't like IVs and they might want intramuscular? How do you think about that? Well,
yeah, I mean, the thing about an IV is, you put the needle in and then you take the needle out, but then you're attached to an infusion pump. There's a sort of some people don't like that, right? They feel like it's more invasive. So when you have an intramuscular, it's just sort of a shot like a vaccine, but the absorption is a little more variable. So what it functionally means is you're kind of deeper when you do an IV infusion. Now, I could give you enough intramuscularly where you would be in danger, and like, for example, what happened with Matthew Perry. But generally speaking, it's harder to titrate. It's a little bit less precise, and it's sort of a slower on, slower off sort of experience when you do intramuscular injection. But some people like that because they can do therapy. So you're not connected to an IV. You can get an intramuscular injection. You and your therapist can talk. And we can, it's a sort of a different thing that you're doing than when you get an IV and you just sort of go deep within your own subconscious and lie there and not talk to anybody.
So this is yet another kind of way to administer this, in that it's not there's the dose that takes you to outer space where you sit back, you put the whole goggles on, not the goggles. Goggles. But
That'd be great. We should do that.
Yeah, you should do goggles, the welding mask. But you put the actual mask on, and then you put the headphones in, and you go in. It's a very personal thing. And then I've even seen some therapists. There was one in San Francisco I'd seen a while ago that was doing these very almost like micro type doses, just to hopefully, obviously not going for that time on brain, those deep neuroplasticity changes, but more a loosening of emotions.
Right.
And do you think there's benefit in that kind of like more microdose version coupled with an actual therapist?
Yeah, I mean, if you just straight up look at the literature, you see that the rates of improvement for depression, let's just say depression, are better with IV administration than they are with the other modalities. But the real question you're asking is, are we trying to achieve something else by doing it with a different modality?
Right.
And the answer is yes, because I have a few patients who they do prefer to do IM and talk to someone because it is accomplishing sort of a different thing. They can get to a more open space. They feel a little bit more emotionally accessible when they're just getting a little bit of that medication, either IM or orally, lozenge-wise, and then they can access and talk in ways that they can't normally when they do therapy. I actually just talked to a patient today who had said that he has a very difficult time talking in therapy. Just he shuts down whenever he approaches his trauma. He had something very traumatic happen to him, and he's tried therapy multiple times, but he just cannot talk. And so for something like that, I mean, he says it's a physical thing. It's like a blockage. As soon as it comes up, I'll start crying. I can feel the emotion, but I cannot talk.
Oh wow!
I can't get the words out.
Yeah.
And so that's in a case like that, this would be very helpful, right?
Yes.
To kind of pull down some of those barriers and let the emotion be more accessible so that you can communicate.
Again, this just really, triples down on this idea that you need to seek out a medical professional to figure out which one of these is right for you, because there's so much variance in what people are trying to do, whether it's PTSD or depression or anxiety or you name it. It's not like it's a one size fits all solution out there. I'd love to talk about Matthew Perry. I mean, obviously a horrible, tragic thing that has occurred. New information has come to light on the more recent side. There's a lot of, I would say, polarized. Like if you go and you read some of the comments on some of these news sites, like it's kind of all over the place, right? And so, what do we know, and what can we talk about to kind of like compare and contrast what happened to him versus, say, what might actually happen in a professional setting?
Right. Well, first thing is that, this medication is extremely effective, but it's an anesthetic and something we use for conscious sedation, which, I think I've said this probably a million times, but you never want to be on a sedative without being monitored. You don't want to be, taking something that's an anesthetic and not be monitored.
Yes.
Not to mention he drowned, he was in a hot tub, which is even more tragic, right? And he had buprenorphine in his system as well, which is also can be sedating.
What is that?
It's used for addiction. It's
Okay.
It's a opiate agonist, antagonist, but it's used to help with addiction. So, it's really tragic for a number of reasons. The other thing that's so tragic about it is that, it sounds like from what I understand, he was receiving the ketamine both from illegally from dealers and also sort of semi-illegally, certainly unethically through doctors.
Yeah.
And apparently one of the doctors had instructed his assistant to inject him, and the assistant is not a medical professional, right? And according to the indictment, he got at least 6 injections a day for 3 days leading up to his death.
Just insanity,
isn't it?
Me.
I mean, if you've ever seen someone experience an intramuscular injection of ketamine or an IV infusion, you almost can't imagine doing that 6 times.
No,
right?
I mean, you've administered to me via injection, and I will tell you firsthand, like so even when you're done, you leave the clinic and you go home, there's no way I'm even getting in a hot tub off of one injection because you're still out of it a little bit. It's post-op-ish, and you kind of want to just take it easy, relax, like be around friends, put yourself in a healthy environment. And when you compound and add those on top of each other,
right.
And especially in doses that can sedate you to the point where you could drown. I mean, it just seemed to be a really inappropriate. I mean, this isn't really the use that it would even come close to what you would do in a clinical setting.
No, absolutely not. But it does also speak to a more complex issue, which is that this is a medication that can be addictive.
Yes.
The biggest tragedy for me is just knowing that there might be people out there who will not now seek out or receive this treatment, who might benefit from it because of this awful tragedy. And I think also those of us in emergency medicine, especially since one of them was an ER doctor, and certainly the larger medical community, we're just sort of disgusted and ashamed that one of us would do this, would act so unethically, and obviously just take advantage of his illness, because addiction is an illness, right? They took advantage of his disease to make money off of him, and they caused him great harm, and he lost his life because of it. So, yeah, I mean, it's really tragic on a number of levels, but to the point about addiction, I have very mixed feelings about receiving this in the mail and just using this as a lozenge, right?
Yes.
I understand. I've had a few patients that have flown in from other parts of the country where they can't get this treatment. And for them, if they need a booster, then I guess that makes sense for them. And if they can't access it without having to fly hundreds of miles. But barring that, getting it in the mail and just using it without supervision, not even potentially even getting a therapeutic dose, but potentially just incurring addiction. That's problematic, and I think it's going to be something that we as a profession need to look at. But also, I think the FDA and the DEA are probably going to look at that at some point, and especially if there is another high-profile situation like this, which it's just any medication can be misused. Yeah. Right. But it's just particularly tragic because this is a medication it's just an emerging modality now.
Yes. So. It was a bummer because it cast this kind of like, immediately people hit me up and were like, are you sure this is safe? What's going on here? And it's like, you have to understand there's the professional use, decades of use of this being a very successful compound in all different types of outcomes and procedures that you're still using today, that every major emergency room is using today. Right. And then there's the street use, which is of course going to carry a ton of risk. Right.
And I think that's really, most ketamine providers, we sort of knew this was going to come because people do abuse ketamine. And so there was this sort of feeling like there's going to be a case like this. It's very unfortunate. I think, though, for me, it's just really important. I just remind my patients, like, this is a medication that can have life-changing benefits for you. Yeah. And the lesson to learn, if there is one from this tragic thing, is that you should not be giving this medicine to yourself. This is something that should be done with a doctor, right?
100%. Okay, so yeah, the other notes I had that was a little confusing is the NIH came out and said that it can cause amnesia without the cardiovascular and respiratory depression associated with common anesthetics. And then the DEA comes out and says that an overdose of ketamine can cause unconsciousness and slow breathing. So like NIH is saying it doesn't depress breathing. DEA says it does. It sounds like if it's too much, it does.
When we first started taking pharmacology in med school, the first thing they would say to us is the dose is the poison. Mm-hmm. It's any medication can kill you. Water can kill you if you take too much of it too fast.
Do you remember like 5 years ago about that talk show host? Do you remember that?
Which talk show?
Oh, so there was a radio show and they had a $1,000 prize or something. They're like, who could drink the most water within a certain amount of time? Oh, God. And this woman drank too much water and died from a water overdose.
Yes, you can. And we see that actually with schizophrenics. It's a very common thing. They'll stand in the shower and just drink and drink and drink until they throw their electrolytes off. You can die from that and herniate your brain from that. So yes, the dose is the poison. Like anything you take too much. And so what you're picking up on there is that ketamine at the therapeutic doses does not depress your respiration, but if you give it too much or too quickly, it will. And like I said, I had seen that. I've seen providers give it too quickly, and what we call apnea, meaning that you stop breathing, but you pick up again quickly.
Yeah.
So yes, that can happen.
Yeah.
You have to know what you're doing. This is not child's play, right?
Yes.
This is a serious medication.
That's why I love that. It's funny when I sat down with you for my first kind of, treatment, I remember you just being like, like my day job's like an emergency room doctor. And I'm like, well, that makes me feel a lot better actually. Because if something did go wrong, you'd be the person I showed up in front of, right? Which is really cool. What do you treat with this? Because I know, well, actually one question, somebody comes in tonight into an emergency room and says, I want to kill myself. I've heard that they will sometimes administer ketamine. Is that not the case?
No. I mean, no emergency room that I know. They should,
but
they don't. No. Generally speaking, when someone comes in a crisis like that, what they're doing in the emergency room, the only reason they have to go through the emergency room is one, to make sure that it's just a psychiatric issue and not a medical issue. Like, for example, you don't have meningitis or something, and that's why you're acting like this. And the second reason to come to the emergency room is to medically clear you if you need to be committed. So if a hold needs to be placed on you. So I need to make sure you're safe to go to a psychiatric hospital, which is going to be different than a regular hospital. So those are the two reasons to go to the emergency room. So typically speaking, ketamine is not administered for that purpose for mood disorders in ERs. I think it should be. It has rapid antidepressant effects. And for people who are suicidal, and this is in the literature, you can kind of look this up, it's crazy. Sometimes 45 minutes after the first infusion, they're not suicidal anymore. That's crazy. When I read that, I did not believe it. I could not believe it. You take a person that's suicidal. This is one of the hardest things in psychiatry. And 45 minutes after giving them a medication, they're not suicidal anymore. I was reading that and I could not believe it. And I have now seen it. So it does work like that. I can't
even think outside of like an IV antibiotic for someone that has like, a blood-based bacteria that's about to kill them. Like what has those rapid effects?
That level of efficacy, right?
Yeah,
Short of setting a bone, there's little in medicine that does.
Yeah.
That's why it's so amazing. I mean, but to be clear, and I'm like such a Debbie Downer. I'm such a skeptic. I tell people this, this is a miracle drug if it works for you, but there are still people whom it does not work for. So, right? So the studies, if you look at them in aggregate, show anywhere from 60 to 80% of people with treatment-resistant depression get better, sometimes long-term remission from treatment, which is amazing. And in terms of like looking at therapy or SSRIs, or like you said, even antibiotics, those are great numbers for medicine, but it still functionally means, and I tell every patient this, if you take 10 people and bring them to me, there may be 2 or 4 of them for whom it won't work. And if that's the case, it doesn't mean nothing will work for you, right? I don't want people to lose hope or feel despairing in that. There is no medication that works perfectly for everyone all the time. Right.
That's a great thing to say, because it as promising as it sounds, there's still some people it's just not
for whom it doesn't work for, right?
And so what is it when you say work? Okay, what do you actually, when someone comes knocking at your door and they say, okay, I have depression, I have anxiety, are there any other things that you say, okay, you're allowed in? Is it like, I'd imagine, I'm sure you've treated veterans before with people with severe PTSD.
Yep, eating disorders.
Eating disorders.
Yeah, I've treated people with, lots of different mood disorders. The evidence is the strongest for depression and secondary to that, anxiety. But there is good evidence for some of those other things as well. We also use it for migraines, for chronic pain. So chronic pain is a really interesting thing to talk about, because for people with chronic pain, there is there is something going on centrally in their brain in which their signaling is off in terms of the pain. And that causes them great anguish. I mean, to be in chronic pain every day is no joke, right? So these people are often also depressed and anxious, but that doesn't mean that we're saying your pain is because you're depressed or, oh, you're all in your head. No, but it is a complex cocktail. And we use ketamine also for chronic pain.
That makes sense to me. There's actually, I can't remember the name of the book, but Howard Stern came out a long time ago where he had really severe back pain. And there was a book around, it wasn't like hypnosis, but it was something more around the psychic, the more psychiatric control of chronic pain and some
The Body
strategies.
Keeps the Score, maybe?
It wasn't The Body Keeps the Score. It was a different one. But it was interesting because it was the first time I had heard like it wasn't a pill. It was like more like, can we manage the mind to control the pain?
Right.
And it sounds like you're saying the same thing. Like the mind can actually be transformed in some way to help manage the pain and lessen it.
So there's 2 things with that. One is that ketamine can help with the depression caused by having chronic pain. People who are in chronic pain are depressed often it's because of the chronic pain and what they're going through, not the other way around, which is important to know, right? So it can help with that, but we also think it can help with the central mechanism that's going on with chronic pain, which is that there's ways in which your brain is gatekeeping signals that are coming through, right? And so I'll give you an example. It's probably easiest to explain with an anecdote. I had a patient come to me. She was walking on a beach and stepped on a bee like several years ago, and it stung her on her heel. No big deal, right?
Was she allergic to bees or?
No.
Okay.
It stung her on the bottom of her foot.
Yeah.
And it hurt like hell.
Pull the stinger out.
She pulled the stinger out. It hurt like hell for a couple of days. It kind of went, the redness, the swelling went away. She didn't get an infection or anything, but the pain never did. And it got worse and it got better. And sometimes it was so bad she couldn't go walking. She couldn't go to the farmer's market. She couldn't go hiking with her other kids. And she went to doctor after doctor. And, they just kept telling her it was kind of like all in her head. They kept explaining, look, the bee stinger's not there anymore. She's like, I know it's not there anymore.
Right.
I see, I've been stung by bees before. I don't know why. And what had happened was that the brain, when you injure tissue, there's signals being sent to your brain, and the conscious part of your brain, or the higher up levels past your spinal cord, are deciding sort of what to do with that signal and whether we need to keep listening too, right? So in the case of back pain, it's really interesting because your back is so central to stabilizing you that you have to listen, right? You injure your back, it's super important for your brain to be like, no, you need to chill now because we need to heal, right?
Yes.
Whereas if you get a paper cut or something, it's maybe not that important. And so a bee sting's kind of in the category of like a paper cut or something. So it's a little bit unusual for her brain to get this signal. So the tissue is injured. It's sending a signal to the brain. We have injury. After the injury is healed, after the inflammation's gone down, it's still sending the signal. And because of that, there's parts of your brain that get sort of the squelch gets turned up too high. It starts listening more than it should. We need to keep listening to that heel. And so any little thing, that touches it, that must be pain again. Turn up the signal. We need to listen. And so that signaling, that part of your brain that is responsible for seeing whether or not we need to listen is what's dysregulated. It's not that there's actually still injury in the tissue.
Yeah, of course. But would you consider that more of an obsessive or rumination type thing?
No, no, actually. It's just very, from the research that I've seen, it's very clearly part of the pain mechanism. It's the mechanism where it's not, I hate conversations where we separate the mind and the body because it doesn't really work like that in biology. There isn't really that distinction.
Right.
But to the extent that you could say, no, it's not just their OCD person. She wasn't. It's that her brain actually it's malfunctioning. It's listening too hard to that part of her body.
Right.
And it still is, and giving it the weight that it shouldn't, right? And so they think that ketamine actually can reset that.
Interesting.
In and of itself, beyond the antidepressant effects, it might be working to help reset that signal.
Did you treat her for that?
I did, yes. So with chronic pain, though, it is trickier, right? There's a lot of other. Chronic pain is a very difficult thing to treat because there's a lot of other comorbid. Depression is very often in conjunction with that, just because being in chronic pain will ruin your life. Right. So
was that a tricky one for you to treat? Like, did she walk away pretty in remission? Or?
It was tricky for me to treat because she was so nervous about doing it that she did one session and she didn't want to come back.
Oh, interesting.
Yeah.
How often is that the case for you, where people will do a session and get a little too nervous or?
I actually don't know if she was nervous and didn't come back. That was my impression, just based on kind of seeing her go through it, but maybe it could have been just inconvenient for her to come back, right? So it's not very often. It's probably like maybe 1 out of 20 times it happens. But I will say that if you do this treatment right, you need to do serial infusion. So that's a really hard thing to explain to people. It's not just one and done.
Right.
And so that can be very hard to fit into your life.
Right.
You got to kind of like take an afternoon off and go trip.
Right.
On a Monday afternoon. So not everyone can do that. So that's part of what makes this logistically challenging is having to do that in series.
Yeah. So let's talk about what that takes. So by the way, is that pretty much the list of things that you treat with this? So we've got PTSD, we've got pain management, anxiety, depression.
And other mood disorders like, bipolar. It doesn't work for personality disorders. So we don't, if someone
eating
comes
disorders,
to me,
things like that.
Eating disorders, yes, we treat for that. Migraines.
Body dysmorphia.
There are people, and there's a lot of research now being done for autism. But it's also problematic because there's the phenotypic expression of autism is very complex. So, but yes, autism also, suicidality, end of life. Sometimes people who are facing death will use this to help them kind of with the anxiety and the fear around death.
And so when you think about those different buckets, I know when depression, Huberman talked about this, like a lot of the studies have been at 6 infusions, and you typically do 6, like 2 a week?
So this is how I explain it to people. So the protocols are 6, 8, or 10 infusions for treatment-resistant depression initially. And how I explain it to people is that the way it's working in 2 ways, as far as we know. So the first way is the trip itself. And
so you said trip a few times. We need to explain to people what trip is.
Right.
Yeah.
Okay. So when you're when you're experiencing a psychedelic, what's happening to you is there's a part of your brain that's shut off.
Wait, hold on a second. Yeah. You said psychedelic. Now we've called this anesthesia before. We've yet to say it's psychedelic. What makes it a psychedelic?
So that's a good distinction. It's actually a dissociative amnestic, technically, if you're looking at the categories. But it has psychedelic effects.
Okay, so let's say dissociative. Let's define each of these. Dissociative just means when I'm receive it, I feel like I'm potentially could be not in my body. Is that the best way to describe it?
Yes, it's a very difficult thing to describe, actually, dissociation. The word is used in pop culture to mean lots of different things, but what it functionally means is that you sort of feel like you're maybe either floating or that your body's like moving in ways that you're not actually moving in. So you may feel like your hands are doing this when they're not,
I felt that so many times.
Yeah.
So I felt like when we were doing the sessions, I felt like my whole body was twisting in the chair and like turning sideways. And obviously I wasn't moving at all. But I could have sworn with 100% certainty that was what was happening.
Yeah. So that's the dissociation part. But it also has a dissociative, it's not just physical dissociation. You can sometimes dissociate from your feelings and your emotions or your memories. For PTSD, this is particularly important. Like what happened to you that caused the trauma. You can see it from a different perspective, almost like you're seeing it from somebody else's perspective, or like you're floating above yourself and watching yourself, like you're a narrator, like narrating a movie or something like that.
This is really important, right? Because if you think about how we process things, emotionally, oftentimes we're so much in the first person, where it's like me, that I'm going through this, I'm the one that has this, blah, blah. And when you get that kind of like one step removed, where you can like, almost like it's a friend you're looking at, and like kind of like treat them with a little bit more of love and kind of compassion for what's going on in that individual. You have to imagine this is why you don't just knock someone out and it works, right? Because like you could give people more of this compound to where they don't remember any of it, right? But you keep them at this dose where they are very much still aware that they're here. They might not be aware that they're in their body, but you are not out, meaning like you can still
talk.
Out. You can
still talk. I've had patients singing. I've even had patients trying to dance, undulating, right? Yes.
Yeah, so you're still here, but so it doesn't work if you take someone all the way to being fully knocked out.
It works less. Yes.
Okay.
And so that what you're getting at is the big black box around the trip.
So that's called the trip.
Yeah, the trip and what it means. And it raises all these issues of consciousness and being and spirituality and belief and what does it mean to be me. It's a super philosophical exercise, actually. And one of the things that's super important to me about this medication is to respect that and to give that the time and the space it needs, because people who have transformations on this experience, yes, they may be cured of their depression. They may feel like their life is 100% better, but they also sometimes and often have profound spiritual and philosophical insights with this and are changed by that, and I think that's really important.
I think it's important too. I think it's beautiful. I also think it scares the shit out of a lot of people, especially if you come from a really religious background.
Yes.
So I have a family member, we won't go into a lot of details of mine, that, I was raised Christian and no longer actively practicing that religion. For all the Christians out there, I think there's some good principles there that are to be taken forward. But I will say that I know Christian friends of mine are like, ooh.
Yes.
I go into this. What am I going to think about God? What am I going to think about the universe? What am I going to think of? Do you get that pushback from patients?
100% yes. And that's the reason that I started this clinic and that I practice the way I do. Because it personally grates on me the whole psychedelic experience seems to have been There's a sort of a way that we as a culture have sort of prescribed to have the psychedelic experience. And it tends to be either really like sort of like 1960s old white dude hippie vibe or appropriating indigenous culture, right? In a way that feels very wrong to me. So 100% yes. And that I've actually treated evangelical, devout Christians, people who have come to me because they don't want, as one patient said to me, she goes, I've been interviewing a lot of providers, and frankly, like, I don't want someone wearing a bearskin rug with antlers behind them chanting, because I don't want my experience pushed in that direction. Right? I need to get better. And I don't need it to be a philosophical experience that you think I should have, or a spiritual experience that you think I should have. And that, to me, that rings really true. I also resist that. And I've had friends of mine, patients, lots of people tell me, I wanted to do ayahuasca, for example, but I got there and then, there was just so much mumbo jumbo, or this person was really pushing me to have the kind of experience that they thought I should have. And that didn't sit well with me. And then not sitting well with me made me anxious, and then I had a bad experience, right? So just to be clear, the trip, what we know about the trip, and I think what I tell my patients is what we know about it scientifically, and you draw your own conclusions about the philosophical insights that you get because of that. And what's happening is there's a part of your brain that tells you what you get to think, and it gatekeeps what stimulus, what information is coming in, and it gatekeeps that into consciousness. So right now, your carotid is beating really loud. Your heartbeat is right next to your ear, and it's super loud. And quite frankly, like, you should hear it because it's right there, right? Yeah, you should. I mean, that's why we use a stethoscope. If I get close enough to you, I could hear it without a stethoscope, your heartbeat right in your neck. It's so loud, but you don't hear it, right? Because your consciousness is like, we get that signal. We don't need it. He doesn't need that right now. If you feel everything all the time, always, you can't drive down the street. Right. So there's a part of your brain that gets to decide what parts of your brain get to talk and what information gets to rise to consciousness.
I mean, the vast majority of the functions we do are not conscious, right? Like, I don't control my heart rate.
You're not thinking about your breathing and your salivation right now, right? But when you're nervous, you do hear it, right? Of course. Or if you're freaking out, or if you're in love, you might feel your heart beating, right? So yes, and what psychedelics do is that they shut this part of your brain off for a second. Okay, ketamine does this. And the rest of your brain gets to talk to itself. And other psychedelics as well. When we look at functional MRI of people who are under the influence of a psychedelic, we see all these parts of the brain lighting up and talking to each other in a very chaotic way. I saw one researcher explain it when you're conscious, your thoughts are all crossing like a tic-tac-toe. Under a psychedelic, it looks more like a dream catcher or a cobweb in terms of the interactions of the different parts of your brain. The part of your brain that likes the Rolling Stones is talking to the part of your brain that smells cookies. Okay, and so that crazy melee of sort of, it's like a free-for-all of all the different parts of your brain talking to each other can produce these incredible insights for people. I've had people wake up from an infusion and say, that was like 20 years of therapy in an hour. I saw the face of God and I understand everything right now. And but it can also produce nonsense. I've had people wake up from it and say, well, I saw a bunch of pink elephants. What was that? It's nothing, right? It's just silliness. So the trip itself, and we know for other psychedelics as well, and I'm going to lump ketamine in as a psychedelic, even though you're right, it's not technically. We know that the trip is important. That if you try to take the psychedelic experience out of it, it doesn't work as well. And there's lots of pharmaceutical companies right now looking to try to take the trip out of it for exactly that reason you said, because most people don't want their minds and their consciousnesses messed with, right? For good reason. So it doesn't, and so I tell my patients, the trip itself, we're not hypnotizing you. We're not messing with your consciousness. We're just turning off a little bit the boss that's conducting everything and duct taping that person, sitting them in the corner.
So and just sit aside for a minute.
And letting the rest of your brain talk to itself. And you can see yourself differently. There are things that you might observe about yourself that will give you insight, but maybe not. And that's okay because of the neuroplasticity, which gets you to the second part of how we really think this works, right? Which is that for anywhere from, we're not sure exactly how long, but maybe 24 to 72 hours after each infusion, your brain has this increased neuroplasticity. And what does that mean for people who are, kind of new to this? When we're younger and we're kids, our brain is like, we're born with a brain that's like molding clay. It's impressionable, right? You're learning things every day. So we know that as we get older, this doesn't go away. You can still learn. You can still change until you're dying.
We're creating new pathways and connections, right?
But it's not as easy. It closes. That window closes. So right around the end of adolescence, that starts to close, and you're not as neuroplastic. So you can learn Greek when you're 7, or you can learn Greek when you're 70. But I'll tell you, we both know which one is going to learn it faster and better. And that's because you're more neuroplastic when you're 7, right? You're still neuroplastic as you're older, but less so. So for about 24 to 72 hours after each infusion, you open up this window of increased neuroplasticity. And from animal studies, where we look at a depressed, say, hamster or mouse and a non-depressed, say, hamster or mouse, we see that depressed hamsters or mice, they have these parts of their brain, their neurons are shorter. they're over pruned, we call it, right? The brain cut it down too much. And after ketamine therapy and after some of the other plant medicines, those neurons grow back and they more closely match the controls or the happy mice, right? So there is something going on here that's beyond just like a philosophical thing, where we actually are growing and changing and maybe possibly healing ourselves.
Could it be something where it's happening at the same time? Like, for example, like I often think about, you know, when I came to you, specifically for a lot of anxiety that was happening. You know, I had a really hard startup. We talked about this, and you know, I was like, okay, I'm gonna give this a shot. My buddy Tim Ferriss had tried it. Like I wanted to give it a shot, and you know, I was just so focused day to day on this rumination of like these issues, and this is happening, and I'm being attacked here, and I didn't, you know, and I was kind of like. It almost felt like ruts in my brain that I just couldn't escape out of.
Right.
And then, you know, when I was in that mode, that hour and change out there, that part shut off. I wasn't really thinking about that. I had other things that were just beautiful experiences and things that were just kind of like, and I described it as like a weight coming off of me. And if I'm thinking that these neurons are obviously firing, a lot's going on at that time, and these new pathways are being formed, is the thinking that like, if we've got these grooves, let's call it depression or something, of these pathways that we always just keep going down, that we're creating these new bonds and connections, and now that's a bit of healing that's happening. Is that kind of what you're thinking?
Yeah, kind of. I mean, look, I had one researcher explain it like this. It's like in the wintertime, if you see a path where there's a sled going by and there's deep ruts and grooves, you know that the sled goes down that path every day, twice a day.
Right.
And what ketamine would be like is like a new snowfall. So you still see the path, but there's more snow on it. So it doesn't look as warm.
And if you want to turn a little bit, you can.
Yeah. I mean, that's what we think. But honestly, there's so much more about this. Right. And look, if you have severe depression, you also might know that you can get out of it by doing things that also will grow new pathways, right? You might travel. You might go and learn
Hiking,
a new skill,
outside,
right?
Yeah, all that stuff helps.
Right,
It's
there's
been
other
proven.
stuff that causes neuroplasticity it's been we're proven by experience. We know this. But one of the things that's so interesting about psychedelics and about ketamine that my mind keeps getting stuck on, my heart keeps getting stuck on, is this sense of awe. And I kind of heard that a little bit in to your point about what you were describing before.
There's been a couple times where I've come out with you and I've just been like, whoa.
Right, the whoa, right.
Wow, I saw the universe. Like,
right. And this is what is so fascinating to me, because we obviously have pathways for awe, and they're important. I don't understand why. I don't know what the evolutionary benefit is of being able to appreciate awe. And this is where we also touch on religion and things like that. But the thing that really changed my mind about awe and made me realize that it was so important, an important part of human existence for us to experience it. We have to have this in our life. I went hiking in med school in the backcountry in Utah, like super far, like 10 miles away from in this southeastern part of Utah. It was
like with bears and shit out there, or was it just
no bears? This was Canyonlands.
Okay.
So this is like hundreds and hundreds of miles from any civilization.
Yeah.
Okay. We then got out there and then we hiked in like I want to say it was like 8 to 10 miles. I might be like making it bigger than it was, but we bringing in all the water so far from anything. There's no one around, and my girlfriend and I set up camp, and I was looking up, I was resting, and I'm looking up at the sky. I'm tired after we set up camp. And I hear this sound, and my mind can't quite put what the sound is. It's like a crunching sound. And in the context of where I was, I couldn't figure out what it was. And then I saw it. It was a plane. It was like, this is like 10 o'clock at night, a transcontinental plane, one, 30,000, 35,000 feet in the air. And I heard it the whole way it crossed over, right? And I thought to myself, well, that's crazy, because in civilization, there's planes going over me all the time, and I never hear them, right? And right after the plane cleared, and it occurred to me that I've been living my life like my brain's been filtering that out and what that effect might be on me. I saw the curtain of the Milky Way hanging in the sky. Like I had never seen it really, I think, that clear, right? There's no light pollution. We're hundreds of miles away from anyone. And it felt like a cathedral, right? I mean, anyone who's seen this knows what I'm talking about. This sense of awe, this thing took over me. It was like a religious experience that you are simultaneously so insignificant against this carpet of stars, right? You're just floating on this little rock and you're nothing. And also you're everything.
Right.
Right? And that feeling, I'm getting goosebumps thinking about it now. That feeling of awe was so beautiful, and it carried me, quite frankly, through like residency, the horrible days of residency, and many years after. I can still recall it, and it will be helpful. It is medicinal.
Yes,
we know this. People go out in nature, they hike, they have to be out.
100%.
It's super medicinal, and we have pathways for it. And I hadn't had it juiced before that, I think, right? And when I had it juiced, it felt so good.
Right.
And what psychedelics do is that they can give you that.
Yeah, so
right?
as can meditation.
Right, as can meditation,
When I have my Zen master on here talking about it, he describes a lot of what you just said.
Yeah.
The sense of awe, the sense of like everything and just appreciation for right now, for what is right now.
And that's something, so for people who are really religious, I'll tell them like, I'm not going to prescribe that for you.
And I love that about your clinic too. When I walk in, nothing about this says shaman crazy, like, you know, it's
no offense to any shamans out there. I respect your work. It's
of course, they have their thing, but you are very much in like the like, come as you are. Like, this is a safe space. Mm-hmm. You know, you get warm tea when you're done. I get my little crackers on the side because you've been fasting. Like, you treat this in a very professional manner in a way that is not like a clinic at all. It doesn't feel, because like I've seen pictures and I've been inside of one of these clinics that was like one of those more shady ones. And it's like, they don't take set and setting that seriously. Right. And I think that's another piece of it, of putting people at ease. Right. Is like making sure that set and setting is appropriate.
Because this is a medicine after all, but it is also maybe a pathway to awe.
Yes.
Right. And so I think we have to give it that respect. And people also need to feel comfortable in order to do this. And I think if you're comfortable, then you're much more likely to have a better experience. And so that's super important, obviously, to me. I'm glad that you appreciate that.
Yeah, it was great. So I'd love to have, do you have a couple of examples of just outcomes that you can talk about? Obviously, we want to keep people's names anonymous. Yeah. And I'd love to know also about age. Like, are you seeing, you know, people in their 20s all the way to their 70s, or like what range is this appropriate for?
So there is actually no upper range for this medicine. It's just that
What's the oldest person you treated?
I think they were 80 something.
Wow.
Yeah. I had a 90-year-old come to me, and 94-year-old, and I actually declined to treat him because he had some other issues that would make it dangerous for him. But you know, as you get older, obviously you have to take more care. Because of the cardiovascular effects of the increased heart rate and blood pressure. Youngest you can treat, I mean, as I said, I trained on this to use in children. So I've used this medication in toddlers. But the evidence is not as good for mood disorders for children. And I think that's because, personally, I don't know if we know the reason for that, but I think it's because they're already so neuroplastic, right? Yeah. So for treating children with depression, it's not as robust, the evidence. Yeah. But there is no...
And they're still changing a lot too, you'd have to imagine, right? So like, what would your comfort level be on that? Like, you say 18 for your clinic, or
my comfort level, again, using this medicine is I would go all the way down to, you know, near an infant if I had to use it. I have used it, right? Yeah,
I get that in the emergency room. Yeah. What if a parent came to you and said, "Hey, I have a 16-year-old that like talks about suicide a lot."
Right.
Like,
I actually don't see anything wrong with trying it. I just would tell them that it's not likely to be as effective. The possibility is that it would not be as effective for adults, just based on the literature. That's just, but I don't actually have a problem with trying it. I don't think, and this is, you're hitting on this point, which is that it's not going to change who you are. I mean, that's what people are scared of. This is going to make you a different person. Not going to make you a different person any more than, you know, when you were 13 and you were neuroplastic and something happened to you that was really important, that made you a different person. No, you're the same person. You just experienced something and it shaped you, right?
Right. I mean, I think if anything, and I'm speaking of like, you know, N of one here, just myself, but if anything, it made me just like a little younger. Like I'm just like, I feel a little bit more like my younger self, where I'm just like, hey, I'm just like a little bit more happy, carefree. And like, you know what? That person said something shitty. All right, let's just like let it go. You know?
So, I've had a lot of patients say that to me, a lot, that I feel younger. And that I even, a few patients said to me that people have said I look younger. And I think it's just because they're acting like that. And a lot of people say to me, this is like when I was in college. I feel like my mind, because I feel, once again, really like, you know, depression will rob you a lot of your motivation, your excitement for things, your attention span. So in that sense, like when you're cured of that, when those symptoms go away, you become excited again, and you start reading again, or you're back to, you're interested and engaged in your relationship again, right?
This must be so just when you go home at night and you see some of these changes, you just must be so thrilled.
I am.
It must really be fulfilling for you personally.
It really is. Like you have no idea. It really is.
What have you seen? Give me a couple examples of like some of the craziest things that you've seen that you can keep anonymous.
I mean, the best things that I've seen is I've seen people come to me suicidal and leave not. I have one patient who, without giving away who it was, but someone very close to her and her family committed suicide. But before they did, and she wasn't depressed before this, before they did, they had 2 years of grinding, like almost committing suicide every day for 2 years. And so she ended up having to care for this family member by like tying bells on the door and stuff to make sure that she would hear if they left a room, because she had to watch this family member.
Like, because they might go to the kitchen.
They might kill themselves, right?
Knives
so can you imagine that trauma of having to do that? And then that person did, and they did it in a really public way and in a really awful way.
Oh, man.
And this person, she collapsed. Like she lost her job. She lost all of her friends. She collapsed into herself. She moved from the city she lived in. She came here to Los Angeles, and she holed up in her apartment with her 2 dogs, and she became agoraphobic. She never left the house. She said she would leave the house only to walk the dogs. Everything was delivered. It was awful. She saw no one. And she fought every day the desire to go commit suicide and join this family member,
Wow.
right? She wasn't depressed before
How did she
this.
hear about you?
A friend referred her.
Okay.
Someone who had experienced the clinic. She came to me, and she was absolutely this was one of the worst cases I've seen. She just absolutely she couldn't do anything. She couldn't call a friend. She lived only for her dogs. And she said to me, I'm only alive for my dogs, and they're dying. They're old. They were like, I don't know, 14, 15 or something, little tiny dogs. And she was like, they're going to die. And they're the only reason I'm here. And so can you help me? And we did. And something really interesting happened, which happens with grief sometimes, is that during one of her sessions, she actually saw the person who died, who killed himself. And she had a conversation with them, and she felt their presence. And she woke up very transformed by that. And that the person in that had given her permission to go on.
Wow.
Like, you can let go. I want you to let go. I'm okay. I'm safe where I am. Like, this is the way she explained it to me.
Yeah.
That she felt that they were on a different plane, that they somehow communicated to her from beyond the grave, wherever they are. I'm okay now. I'm actually at peace now. You need to not do this. I
mean, that could be her own subconscious talking to her. Like, we're not saying it's
I'm not saying what it was. I have no idea what it was.
Right.
I'm actually much more skeptical on the scientific. So I'm much more inclined to just try to look through the literature for neurological reasons why she had this, right? But I'll tell you that this is not the first time I've heard that for people who come to me for grief either.
Yeah.
So, but she said, no, it wasn't like I had a dream where they came to me. It was like I smelled him again. And she started weeping because she said, I'm so sorry. I forgot what you smelled like. Like, in the thing, she was apologizing to him because she smelled him again, and she had forgotten what he smelled like. And I'm so sorry I let go of you. I've been trying to hold your memory for a year, and I lost your smell, and now it's back, and now I'm so sorry. Please, forgive me. And, he said to her, you're not meant to remember. You're not meant to hold on to this. I'm okay. You have to go. You have to go. You can't stay here with me in this plane. She said, I want to stay here forever with you. You cannot. And I promise you, you will find me again. You'll be okay. And that, she woke up from that, just tears streaming down her face. I remember digging my fingernails into my hand to not cry, and I lost it. I was crying with her, right, obviously. But she got better. She met with her agent again. She started working again. She started learning Chinese so she could get some roles. She started calling up friends and family.
Oh my God.
And socializing again. And because
did she need all 6, all 8, 10?
She needed 10, actually.
Okay, so
she
you took
needed
her all the
more.
way.
Yep.
Yeah.
Mm-hmm. She needed more. But she did it. She got out. She started working again. She got out of her apartment. She reached out to her family again, her friends again. She made it. She crawled out of that hole. And I remember when she came to me the first couple times, because it doesn't happen for everyone right away after one treatment. Most people actually, it takes 3 or 4 before you start to see any effect at all. And I remember her so frustrated the first couple of times. Even getting to the clinic was hard for her.
Yeah.
Getting dressed and getting out. And I told her, that silly parable about a donkey at the bottom of the well? Have you heard that one?
No.
That a donkey falls in a well, and the farmer looks over and sees the donkey at the bottom of the well, and it's like, I'm not going to be able to get that thing out of here, so I'm just going to bury it. alive.
Yeah.
I don't know why. So he starts shoveling the dirt into the well, and the dirt falls on the donkey's back, and then he shakes it, and it goes on the ground, and he stomps on it.
Yeah.
And then the farmer keeps doing that, and he eventually makes his way out of the well. Right? I told her the story in the beginning, like, look, we're gonna do this, but it's gonna take a long time to get out of this well. And it really resonated with her. And around the third or the fourth, she was like, oh my God, I can see.
Okay, she's seen bits.
I can see the sunlight. I think I can see my way out of here. Like,
right.
And so, I mean, I have lots of stories like that, but that's just like, and she did it. But my point is, like, she actually made it all the way out of the well. She got out.
You sit with every patient after you're done. Like you've come into my room and you come into others, and you just like do a debrief kind of like afterwards. What are the most common themes that you see? I'm just fascinated after treating so many patients. What do people say that they experience?
So a really common thing is self-esteem and self-compassion. It's a huge, huge thing. And it's interesting because I feel like for men, it's harder for them to admit that, but it's self-esteem and love for themselves.
I felt that with mine. I came out there, I remember one time I was like, why am I taking everything so seriously? I was just like beating myself up and like really carrying this burden of just like, I was just like taking everything so seriously. And when I was out there, I don't know what it was, because we should mention that you have a journal sitting right next to people's tables that you give them so that they can write down, because you do kind of lose some of the your thinking, and so it's very important to journal afterwards and
if you can. Some people will record on a phone or
and so it's like, but I remember just kind of like rebuilding myself as kind of like a part of. And by the way, we should mention music I would imagine a lot of people is a big part of this. I put noise canceling headphones on.
Yep.
I have a great playlist that I use.
Yep.
Do a lot of people use music in this as well?
Yeah, I mean, there are clinics where they put stuff on a screen for you to watch. There are places where you don't use music, but I think music helps a lot. And music, and so the best way to do this is to have noise canceling headphones, have a playlist, no lyrics usually for most people. They don't like lyrics.
No lyrics.
And music that evokes emotion, because the best way that this medicine works is when it can allow emotion to well up so that you can kind of look at that emotion with dissociation. And when you can kind of look, it's like a window into your own self. Because I think what I've learned from doing this now for hundreds and hundreds of patients is that we seem to all have this, like, I want to say code running in the background, all these different codes like running, and we're not always aware of them. And our emotions are kind of going up and down in their own currents and eddies underneath, right? And the gatekeeper's not allowing us to be aware of them, right?
I think of this all the time. Like I consider us like little mini computers where you have an operating system running underneath, and there's like all these little things that are allowed to service and not, and like little bugs in the code.
Do you want to know what's really interesting? I read this in a book a while ago, but apparently human societies all over the world, we always conceive of consciousness based on the highest level of technology we have at the time. So like the Romans, they used to think, because your brain has these big holes in it called ventricles and lots of fluid bathing it. And the Romans had aqueducts. That was their great technology. And so they thought thinking was when the fluid around your brain was like sloshing around. And so like when you thought like this, that the thinker, like Rodin's the thinker, if you put your head forward, it's because the fluid is like going forward in your brain, and that's giving you like consciousness. So it's just funny to me, like we as humans, we always use the highest technology we have as an analogy for consciousness.
Totally.
And so for us to be talking about computers and AI, that makes sense, right? But whatever it is, it seems like the best way this medicine works is when it allows you to see that code. Right. And you can do with it what you want. And that's why this is like, there is no prescribed philosophical or religious way to do this. Because if you use this medicine, right, you're just going to be able to see yourself and see the things that are kind of like pulling your strings and in a different way.
Yes.
Right. And so, like I think the best thing, music is good because it sort of evokes emotion, and that emotion will kind of carry you into the journey or the trip, whatever you want to call it, and allow you to sort of like play in those emotions and see them and see how they're affecting you.
Yeah, 100%. So, a lot of people worry with things, probably largely due to, painkillers and the society we live in around addiction to substances, right? There is, even though this puts you out into a state, there is no high. Like you don't, like, you know what I mean? Like you're not feeling like, I had a chest surgery one time. They gave me Percocets. that's a high. Like, you take a few of those and you're like, oh, I feel warm and fuzzy all over. I could do this forever, and you're like, oh, wait a second. This is why we have the opioid crisis, right?
You know what though? That's that's your experience, right?
Yeah.
Other people will say the opposite. They'll say, oh, I took Percocets, that wasn't a high, but this is a high.
Oh, really?
Yeah. And so what you're touching on, okay, so addiction is such an interesting and tricky topic because ketamine is used to treat addiction.
Right.
I don't know if you knew that.
Oh, I didn't know that. No,
yes, there's good evidence. Actually, a lot of it coming out of the UK. Ketamine is used a lot for alcoholism, alcohol use disorder, but it's also used to treat other forms of addiction like cocaine.
Okay.
Yeah.
I like my wine. Maybe I should come in for a little boost.
Yes. And in fact, a lot of people do describe that it reduces cravings for alcohol.
Yeah.
So, but it also can get you high. That's your experience though. But so what makes something addictive?
Sense because we do see street usage of it, right?
We do,
and people
right.
wouldn't be doing it on the street level if there wasn't something associated with it.
But what's so fascinating about addiction is what makes you high is very much dependent on who you are and the society you're in. Because as an ER doctor, there were people who used to come into the ER for IV Benadryl, like to scam us for IV Benadryl because they would get high off Benadryl. Like you're so confused right now.
Why would they just buy that at the store?
Your face is like this right now, but like my point to explain you because it's not the same as IV. That's why.
Okay.
But my point is that like it's not the substance that makes the addiction, right?
Yeah.
Well, it's the substrate. It's the person and the stuff they're going through and the society that they're in, right? There's a reason why like crack cocaine was a big thing in the 80s. It's still addictive, but it's not so much of a big thing as now. The opiates we've had opiates for 200 years, maybe actually more than that, like commercial opiates used for medicine we've had but there are certain circumstances, socioeconomic, societal, cultural circumstances that make things maybe more addictive to certain people or certain groups of people, right? And it's very complex. So it's not the substance.
Okay.
This
is really helpful. This is like clearly, I hadn't thought about that. Yeah, you're framing it in a way that makes a ton of sense. It's like, it explains why we do see street usage of it. Like
we do, and to be fair too, IV is different from like if you're snorting it at a concert or something. That's I sound so old snorting at a concert. I don't know. If you're in the club and you're using ketamine, it's a different experience than IV. IV is much more intense. So I think what you're explaining and what we generally agree with is that the IV experience is so intense that it's less likely to be addictive.
I see.
That experience.
Okay. Because when I walk out there, I'm like, there's no way in hell I want to go back and do that again. I need a few days break.
Right. It's intense, right? Yeah. It doesn't, not for everyone. Sometimes it's just relaxing or confusing or just chill.
I'm very chill when I get back home. Yeah. I just sit in a rocking chair for like 2 hours and just enjoy the afternoon. Yeah. I mean, I love that you called the clinic Golden Afternoon because I'm like, this is exactly what it is.
This is exactly what it is, right?
Yeah.
We called it that because that's a poem that's at the front of Alice in Wonderland.
Yes.
It's the author of Alice in Wonderland decided he would write the book when he was on a ferry ride back in the afternoon with Alice Little, the girl that it's based on. And he's basically talking about a liminal space. So a space between spaces, right? Mm-hmm. And a time between, and just that afternoon, that space gave him the inspiration to write Alice in Wonderland. But liminal spaces, like awe, are important for humans, right? Spiritually important, they're medicine, and we need to be in that space. And that's another thing that psychedelics can help you be. They can help you get to that liminal space.
Yes.
And that in and of itself can be transformative.
100%. Couple more questions for you. Boosters. So I have a friend of mine. She's a dear friend. She did this 3 years ago for severe depression. It not only did it fix her severe depression, she felt a big pop happen in her 6th session. Mm-hmm. She was pissed. She says she was pissed that she bought the whole package. She did this in a different state, and she bought a package of 6, and like every single time she's like, I don't like this, I don't like this. And then number 6, she like physically heard a pop. Her depression went away. And she said her body dysmorphia did as well. She had some feelings around that. She hasn't needed a booster or anything since. Right. She's been completely fine. Some people, they can benefit from coming in and getting another treatment.
Right.
How does that shake out? Where do you see that? Like what
so the science on that, we don't know.
Right.
We don't have studies to show who needs boosters and how often, which is unfortunate.
Right.
So some people can come in, they can be cured, and they never come back and see me, right? And I don't know. And then other times they can be cured and they think they never have to come back, but then something awful happens and maybe sends them back into a spiral. So part of it is like life, right?
Right.
You lose your job, your family member dies, that might send you back somewhere. There isn't a lot of great evidence about who needs a booster and how often it should be done.
You never prescribe boosters.
I don't push it. I definitely say like, we're here if you need us, because I don't want people to feel like, oh God, it didn't work after 6 months if they're starting to feel depressed again. I explain that you can come back in. But I don't prescribe it because we have no way of knowing who needs it and how often. But what I do tell people is, look, the most often I'm comfortable doing it is usually once or twice a month. Okay. And that's usually for anxiety, because anxiety is a trickier creature than depression. But I have patients who will come in and see me maybe after 6 months or a year. I have patients who schedule it every 8 weeks or so because they know they want to get ahead of their symptoms. So booster, it's a
what a wild thing.
It's a wild thing.
Some people don't even need it, and others need it like every few weeks. But
yeah, it's a wild thing.
But still, that's better than suffering, right? Like it's amazing.
Is. But it's kind of like ibuprofen. Like if you have arthritis, I don't know how often you're going to need to take it.
Right.
Maybe,
Have you seen any downsides, like in terms of literature around? I've certainly seen that if people, I remember reading some article around it, the people that snort it, stomach lining issues, bladder issues with people doing it recreationally.
Yeah. So if you Google it, there's all these horror stories out there, right? And so I don't want anyone to be scared, because most of these effects that you're talking about, so you're talking about this kind of aggressive kind of cystitis that can happen, cystitis meaning affecting your bladder, that is awful. And this is affecting people who are taking like 1,000 milligrams a day, daily. And just for context, like your dose would probably be like 80 milligrams.
Yeah. And by the way, we should say, it's not the same dose for everyone.
No, it's weight-based.
Yeah,
it's weight-based.
Every time I would come in, you would always put me on a scale. You get and you do a milligrams per kilogram of body weight ratio. Right. And so it's not like it's just like same shot for everybody.
That's right. Yeah. Yes. And it's also, we also have to titrate it because sometimes it takes more for someone to get to a psychedelic place than others, even within that range.
We've had a friend that's a relative of mine that came to see you that needed a pretty big monster dose.
I wouldn't say that was a monster dose, but higher. Yes.
A higher dose before they felt any of the benefits.
But that's not uncommon. Okay. That's not uncommon because the psychedelic place that we're trying to take you to, it's going to be different for everyone, right? Right.
But you said that there was like some red-haired people for some reason with that genetic disposition.
There's a thought. Well, so redheads in general need higher levels of anesthesia and lidocaine, right? It's like a variant on the gene that they carry.
Is that like a known thing?
It's a known thing in anesthesia, and it's a known thing in anesthesia. But I don't know actually if I haven't seen any studies on this for ketamine. I don't think there are any. But anecdotally, in the community, there's this sort of idea that if you're a redhead, you might need more. There's this anecdotal thing that maybe if you're on the spectrum, you might need more. I think that it's very hard to know because most doctors aren't trying to figure out if a person had a psychedelic experience and how psychedelic after. They're just giving the med. They're just clearing the patient, and then frankly, they usually don't even talk to the patient again after they let the nurse just administer the next sense, right?
As to why you're sitting in and asking questions like, how was it?
Right. So I usually come in after and I'm not trying to like do therapy or anything. I just need to find out like how psychedelic was this? What did you see? So I can get the dose to the right place, and that's different for everyone.
Yeah, because you kind of dialed me in. It's like the third or fourth time I went in there, we nailed it, right? And I was just like, wow, okay, I got the full thing.
Right, because we know that's important, right?
Yeah, that's so cool how you do that for each individual patient. Okay, so last thing, pricing for this, some people are priced out, sadly, because it's not cheap. I mean, you have like real clinicians you have people that are putting in IVs that are working for you. You're not the obviously only one there. So you have to hire medical professionals.
Right.
Insurance doesn't cover this.
Right.
Is there any reimbursement in the horizon for this type of stuff?
So I don't really know how they're getting away with not covering it when it's so effective, honestly.
Right.
Like as a human being, I just don't sort of understand that. But I do know it's not, so we should mention it's not FDA approved for this indication and what that means, right? So we're using it off label in the clinic.
Right.
And lots of medications are used off label. Like if I use birth control pills to treat your acne, that's off label. And what it means is like if you have a medicine, you create it, you invented it, you will want to push it through all these experiments to show the FDA it works for this thing. I said this medicine would make your rash go away, so I have to show you that it did.
Right.
Just make your rash go away. If we simultaneously discover that it also makes your legs stronger, we have to do a whole nother thing for that to show to the FDA. So ketamine's been generic for a long time, right? So there's no money to be made in generic ketamine. It's going to cost billions of dollars to push it through the FDA to get approval for it. So there's no real incentive. I don't know why. Because I think the studies conducting like these kinds of high quality studies are very expensive, right?
Yeah.
So Johnson & Johnson decided they were going to tweak the molecule. And make something a little bit different so they could patent it and then push that through the FDA approval process. Which they got through. And so what they did is they took ketamine, which has 2 enantiomers. Now, enantiomers are just the same molecule, but mirror images of it. And in biological processes, when when you have a receptor and a chemical that's reacting with a receptor, it's like shaking hands. So if you can imagine, a right-handed shake and a left-handed shake are not exactly the same thing. So that's the R and the S. So what Johnson & Johnson did is they took the R version out. So now we're just giving you the S, and we're putting it in a nasal spray. We're going to push that through the FDA approval process. They did. They spent the billions. They did. And then after that, they marketed that as FDA approved for depression. That is covered by insurance if you have failed multiple SSRIs. Depending on your insurance, it depends how many SSRIs you have to fail, okay? And that doesn't work as well because they took the enantiomer out because biological processes very often involve chemicals that are both enantiomers. So
plus it's intranasal.
Plus it's intranasal.
You're not getting a high enough dose.
But even when you do head-to-head studies with, the 2 enantiomer version intranasally, the 2 enantiomer version works better.
Yeah,
R
I bet. And also you have to go into they don't prescribe it to you to take home.
Right, for ketamine, right?
You have to go into a doctor's office even to get the nasal spray.
So my point about all that, bringing all that up is we are using this. I think that's why it's not covered because it's not FDA approved. It's off label, so they can kind of say that, which is super unfortunate.
I wish we could somehow raise the funds required to get those trials done. So insurance could cover this because it's expensive. So what are you currently charging per dose?
So we do, if it's individual, we do $750 per infusion. If you buy a package of 6, it's $600 per infusion. Okay. And it is super expensive, and that causes me a lot of anguish because I never want to turn anyone away. But the problem is that you have a really high level of critical care doctors and nurses that are present.
Yes.
To watch over you while we're administering this.
We should mention that you have cameras in the room, which I think is a great idea because it's more like, for me, it was like my music stopped working. Yeah. I can't control my phone. And so you watch and like if someone raises their hand, someone's in there within 20 seconds.
Yeah, we don't record. We just use it to observe. And
which is huge.
It is huge.
It's important, right? Like, it's like you're out there by yourself and you also don't want somebody sitting over there watching you like when you're in your journey.
Exactly.
And so it's like one step removed and it's safety. It's like you feel like you got a supportive back there, but also not someone that's just like hovering over you. You know?
Exactly.
Which is quite nice.
Right.
But, so I appreciate that level. But yeah, I mean, I was talking to a ketamine doctor up in the Redding, California area, where I was born, and he was really upset because he's like, listen, like he also has a practice outside of that because like oftentimes doctors have to have both to kind of support it, and he's like, I treat a lot of veterans, and he goes, they just don't have the cash.
I know.
And he's like, I will like give them super insane discounts. And like, he's like, I'm like losing money on some of these people. He's like, but I can't turn them away.
Yeah, I've done that too. And I mean, there are some organizations that are sort of like charities that collect money for veterans to be used for them to receive psychedelic medicine.
Do you know the names of those? We'll put those in the show notes of this episode.
I don't, but I want more of them. I want more people to. I've had a few people contact me trying to set this up. So if anybody out there has a lot of cash that they are feeling like, helping set up a charity and help it has to be local because, you're trying to get people to. Yeah. But
even if it's just like an offset, right? Because like the difference between somebody coming up and saying like, if we could put together some fun and you say, hey, listen, Kevin, I've vetted this person. I'm not going to obviously give you any of their information, but here's the kind of profile. I think they're really, they want to kill themselves. They're a serious, very serious case. And, they can afford $250, but they can't afford $600, and like, that's where you pool people's money together and we get people help.
Yeah.
Like, oh gosh, I wish that could be some kind of like tax route because you could do that through a nonprofit arm. That might be interesting as well.
I think you can. And I've heard of these things happening. Yeah. I don't know anyone personally.
We're just brainstorming in real time here.
Right. We'll figure this out. Right. And also treating them can also, I think, be, tax deductible, but that's what my accountant was telling me. I mean, this person was trying to set up a charity. She came to me to talk about this, but it is, yes, I wish it were more accessible. And so a lot of times people, because they can't afford it, they'll turn to the intranasal or they'll use the lozenges, which are less effective and yet have a higher abuse potential. So that's unfortunate too.
Yeah, it is. All right. So one of the things I was wondering if you were open to is, like you said, you do these boosters. I would love to, the anxiety treatment I've had from you has been amazing. We first started like 6 months ago or something. And like, I've felt the lasting effects of it has been great. I feel just I take on a lot of work with ease now, where it's
good.
like I just don't have the same kind of like weight to everything. That's the only way I can describe it. The best analogies I've ever come up with has been like, I'm still doing crunches in the gym, and I hate doing crunches, but I don't have the 25-pound backpack on. That's like the best thing I can come up with. And it's like, life's not a wonderland, but it's way better.
It's a circus. It's a circus.
Yeah, exactly.
Right?
Like,
yeah.
Back to her. Like
Right.
it's a circus, and that's okay.
Yeah.
But I would like to demystify this a little bit further. If you would allow a camera into your actual facility, I think it could be fun to transition and actually show people. And I would love to just, do the intermuscular, which is where you give 2 shots for the treatment. You get the same full ride. And for as long as I can, I think I can, with a mic on, describe to people exactly what it's like to feel this.
Oh, wow.
At least in my...
Yeah, that would be great, I think. I think that would be really interesting if you're comfortable doing that.
I mean, why not? Like, I think I've had, as you can imagine, I've had so many people reach out to me after this and be like, I don't want to, well, actually, we'll say this, because I know he'd be okay with it, and I'll double check before we air this episode. There is someone that you and I both know, because he was a patient of yours, that is a very famous entrepreneur. Has built companies much larger than I have ever done. Definitely a household name. If we said it, we're not going to. Came out singing your praises and hit me up. I hadn't talked to him in years. And he hit me up and he's like, Kevin, like, your podcast, I got turned on to it. I did it. It changed me. This is amazing. And that's awesome. Like that when I heard that, I was like, wow, like that person can, is such an amazing entrepreneur that I know that them being in the right state of mind is just going to make the world a better place.
And let me tell you, that person also turned around. The first thing he did was reach out and try to help multiple other people.
Oh, really?
That's the very first thing he did when he got better.
That's amazing.
Yes, so he has actually made the world a better place, literally. And he actually has paid for people who couldn't afford it.
Oh, that's fantastic.
Yep, and he has, I can personally tell you, he has saved several people's lives.
That's awesome.
So yes.
So he was out of town. We're supposed to catch up here soon, and I'm sure he'll share those stories, but that is... Oh, I just love hearing that kind of stuff. And so, but I think back to my point about the common question is like, I've had people come to me privately and, you can talk about it on a podcast with Tim, and that was awesome. But to actually see what it's like, to get a glimpse behind the curtain, like what is it like? What does the place look like? What does the environment look like? What does it feel like?
You wouldn't be nervous to do that in that vulnerable state. That's interesting.
Like, fuck it. Like let's like, why not? It's like, I think it's important that we make this seem a lot less scary, because there's so many people that read the very unfortunate Matthew Perry story and say, oh, I'll never touch that.
Right.
And it's like, you kind of have to understand that, like to your point about this whole episode, it's like the dose is the poison, and there's very beneficial things that can happen at the right dose, and you take that very seriously.
Yeah, I part of this is also the stigma that comes with it being "quote unquote" a drug, you know, and with the whole war on drugs and Nixon Reagan propaganda about hallucinogens in general, which is so unfortunate that we as a humanity have a medicine that can help so many people. And that they're afraid to use it partially because of that. That's really, So yes, I would be on board with that. Let's do it.
Well, thank you for doing this interview. And then I guess we'll just cut over to me sitting in the chair and getting ready.
Awesome. Let's do it. Awesome.
Here I am. I'm at the clinic at Golden Afternoon. This is in Santa Monica, California, which is on the west side of LA. As you can see, it's a beautiful space, bright colors, a lot of fantastic books on the shelf, some of which I've read. Actually, How to Change Your Mind with Michael Pollan. If you get a chance, go back and listen to my interview with Michael Pollan. That was a really good one as well. Tea here, very, very calm, safe. Set and setting is so very important when you go onto one of these journeys. Also, I think it's important to say and really get into actually why I'm doing this today. Why am I here? I wanted to give you a tour of the facility. I wanted to show you what a high quality facility looks like, but I also wanted to take some time and walk you through a few really important points to hit before we actually go in and do the treatment. So first and foremost, why am I doing this? It is not to convince you to do this. You know, I'm not a doctor. Dr. Jen is not your doctor. This is not an endorsement of treatment. There are risks that we discussed in the episode. There are also risks that we did not discuss in the episode. My hope is that given how many people watch this show, which has been fantastic, we had great viewership, I know based on those numbers, you know, some subset of people out there are sitting with crippling anxiety, or they may have treatment-resistant depression. I'm sure there are even some that are fighting off suicidal thoughts. A friend of mine came to me after I had my sessions done. This is a colleague of mine, and they said that they were having some really dark suicidal type thoughts. They said that they weren't thinking about taking their lives, but they were encouraged to go do this treatment. And so they came in here to Golden Afternoon and did a series of treatments, and now, thankfully, are in remission. When I saw that, along with a few other friends now that have been through this, I was convinced that this could have some benefit for other people. So I wanted to bring you here today to just kind of demystify the whole process for you, to let you know how approachable it can be and how non-scary it can be, what a good high-quality clinic actually looks like. For me, even if one person that's watching this show gets some relief from it, it will have been worth it. Also, I wanted to let you know I have zero financial ties to Golden Afternoon Clinic. I'm not an investor. I'm gonna pay for today's session. This is very important to me. I always wanna have full disclosure on all that stuff whenever I do it. And then lastly, what are we gonna do? So we are going to do 2 intramuscular shots in my arm of ketamine therapy. I'm gonna try the best that I can until I leave my body to describe to you what I'm feeling. What does this feel like? What is the sensation as you kind of lead up to that moment where eventually I'll pull down my eye mask, I'll have my noise canceling headphones on, and I'll go on a little journey for 45 minutes to an hour and then come out of it. And then we're gonna talk to me afterwards. So, you know, we'll go in now and talk with Dr. Jen, do our step on the scale, get weighed. That's very important. We need to know how much I weigh so they can dose it appropriately. Everyone's different. I wanted to bring you through every step of the process and make this feel a little bit approachable if it is something that when you talk to your doctor, they say it is for you. And I know there's a lot of people out there that are suffering. So my hope is that we get a few people some high quality treatment. And with that, let's step in and see what this looks like. All right, let's do it. I'm exposed to the world how much I weigh. 86.4 kilograms.
All right. When you're ready, go ahead and have a seat.
And this is the anti-nausea?
Correct.
Okay, sweet. So I take that now, or?
Take it out. Well, yes, if you'd like.
Okay, cool. Yeah, so Zofran, right?
Correct.
Yeah, so this is Zofran, standard classic anti-nausea med. I'm gonna do this under the tongue. It's 4 milligrams. Not everybody gets nausea on this stuff, but you know, it's just like a preventative thing, and it's, I've done it before and it works. So we're gonna start off by filling out a little form here. This is a questionnaire around depression and anxiety. One is called the PHQ-9 and the GAD-7. So they ask you questions like, you know, do you have little interest or pleasure in doing things? Are you feeling down, depressed, or hopeless? There's, it looks like there's, you know, almost close to 20 questions here. And then you circle not at all, several days, more than half the days, or nearly every day. And then they tally up the score so that the doctor has a sum score of where you're at currently today, and then they can kind of track that over time and how your symptoms are improving.
Get you all covered up.
Thank you.
Get you all comfy. Are your arms in this? How did you feel after your last injection?
I felt fine. Yeah, it was actually no problem at all. I had a little bit of soreness the next day, but you know, to be expected.
From the arms? From the...
Yeah, just from the injection, but
No
that's...
headaches, no lightheadedness, no dizziness.
No, none of that.
Thank you. Some slow, deep breaths. Alrighty. Have you picked out a playlist?
I got the playlist ready to go. Yeah, and I'm just gonna let me make sure I can actually sync this up first. Pro tip for those watching, make sure you have downloaded your playlist so that there's no interruptions. Get my mask ready to go. Okay. All right. Oh, let me put this back a little bit.
Oh, I know.
Okay, thank you.
Tell me when. Let me put this on your finger.
Yep.
Go into outer space.
Yeah. There we go. Yeah, you can just go. I like going back as far as possible, so that sounds good. All right. Perfect. Thank you so much. All right. So obviously situated, cozy. Got my heart rate monitor on. We're going to be testing, I think it's like every 15 or so minutes, they check your blood pressure. There's a camera in the corner there, which is pretty awesome. It doesn't do audio, but they are always watching you. So if you need anything, you can always just kind of raise your hand and they're like in here within a few seconds, which is great. There's been a couple times I've had like audio issues where my audio's cut out and they come in and help you out there. So I guess it's time to do it. Time to do the shot.
Hey, Kevin, how are you doing?
All right, we're doing it.
Yeah, how have you been feeling?
Pretty good, yeah. I mean, obviously, being on camera doing this creates a little bit of like, what is the world going to think of this whole thing?
I bet.
But, excited for a booster. I think, taking something like this and then going into some good cardio tomorrow, getting some meditation in, like just doing healthy brain activities to reinforce some of that neuroplasticity that's happening. Obviously, probably a pretty good thing. Any other things you'd recommend to people, like one post-procedure?
Well, the post is important, but also getting in the right frame of mind before you come in. So, I mean, you probably talked about this already, but you do have to fast.
Yes.
And you do want to be in the right headspace. So if you've been consuming any media that's upsetting, or if you've been having an argument with your mother-in-law or something right beforehand, you want to kind of let that all seep out of you and be in a relaxed state and an open and curious state.
Yeah, I mean, it's a great reminder, though, because I think one of the most important things is this idea of, when you're out there and you're somewhat conscious still, it can be a little bit like, where am I right now, right? And if you question that and you don't let it go and drop it, it can be a little anxiety producing, right? And so I just have this mantra that I've used successfully so many times of just this, and just letting it go. And so if something seems weird, if I'm not sure where I'm at, I'm like, I can hear my music, that's my connection back to where I am, and just let it go. And then immediately that kind of shifts my perspective and I'm good to go. Was that a pretty common, is that a good strategy for something like this?
It's a big issue, and a lot of people have a hard time letting go. If you have anything uncomfortable that comes up, anything at all, fear, anxiety, a bad memory, sadness, if it's bothering you and you feel yourself kind of resisting, just get curious about it. Try to look at it, welcome it, let it come in and sit at the table and listen to what it has to say. And often, if you're curious enough, the uncomfortable feeling will dissipate.
Yeah.
But just to remember, as you know, there's no wrong feeling in here, right?
Yes.
It's just a way to look at yourself.
Yeah, and every session's gonna be different, right?
Absolutely.
So there's some rocky ones, and that's part of the process, and there's some amazing ones, and that's just it feels like that's how they typically go,
Right. It's your subconscious, so
yeah,
it's
exactly.
it's not a predictable journey, but it is a worthwhile one to take. So that's great. Is there anything that we can do to make you more comfortable while you're?
No, I think I'm
ready?
all good to go.
Good?
Like we said, I'm fasted. There's no liquid here, so I'm not going to be drinking anything until after post procedure. And I'm going to try and stay kind of semi-conscious as long as I can after the first shot and try and talk people through the experience on what this is all about.
Yeah, feel free to just say whatever you need to say, let out whatever emotion you need to let out.
Sounds good. Thank you.
Okay, great. All right, you ready to go?
Let's do it.
Let's do it.
So let's set the mask.
I'm going to try and stay conscious as long as I can until it goes.
In your arm.
Shots are always fun.
Enjoy your journey.
All right, thank you. All right, shot 1 is in. Here we go. So the shot on a 1 to 10 in terms of pain, I don't know. I'm not that bad with shots, so this for me was pretty benign. But they just squeeze the muscle a little bit, push it right in. It's an intermuscular, so it's not subcutaneous. So they have to go in a little bit deeper into the actual muscle. Right now, obviously just 1 minute in, so not feeling anything yet, but I'm just gonna sit back and relax. And thankfully got Hayden right here with me, hanging out until I go to La La Land. And we'll see what happens. So then I'll let you know as the textures start changing or whatever else comes up.
Did you come in setting certain intention?
Good question. So my intention going into this is just to really, hopefully, one, relax and reset myself, and give myself a little bit more grace and allow myself to have even less anxiety and set myself up for the coming months, but also is a gift to everyone else that is hopefully suffering and can see that like this is something that's approachable. It's something that they don't have to be scared of. So my intention is to help others and also give myself a little bit of relief as well in terms of just the burdens that we all carry. So let me give you an update. It's about, what would you say, in 2 minutes in? The first sensation I'm starting to feel is my eyes are getting a little bit slower in that tracking around the room, like looking from one side to the other, is taking a little bit longer than it would normally take. I feel a little bit of warmth, I feel a little bit of just kind of like body buzz. So there's like a kind of a natural body buzz. Yeah, we'll just let this kind of unfold slowly over the next few minutes, and I'll do my best to describe how I'm feeling. And Hayden, feel free to ask questions.
How does the seat feel? Do you feel like you're slowly falling into it and settling into it deeper?
Yeah, so right now, I feel like the seat, it almost feels like it's starting to wrap around me a little bit. Imagine like a glove or some type of like free falling into a beanbag almost. Like it's like sucking the body in a little bit. So you get a sensation of this wrapping that's starting to happen around my body right now. So when you're listening to me and you're seeing this, like know that like I'm truly like feeling this right now. Like it's actually, it's kicking in right now. Like it's hitting and happening, and it's going to get harder very quickly to describe what is happening, because as this compound takes hold, I'm not going to be able to describe things as well. So it's starting to, as you can probably tell, it's starting to kick in. So now that we're, let's call it 3-4 minutes into this, it's lighter, like you said, Hayden. Things pull back a little bit. So visually, it's just, things are just kind of being pulled back. It's hard to describe. This is we're gonna have to edit some of this, but it's starting to kind of pull back, and reality starts to. God, how can I describe this? Okay. Obviously, we're not going to air this, but Hayden, I'm glad you're here, brother. Thanks for being here. Yeah. Thanks for helping me demystify this for people, because it's important that people have a sense of. It's so hard to get words out. So this is the point where you start to lose touch with the entire process, the entire room. So here we go. Dude, I'm so excited. I'm just gonna shut up now. All right, so I'm gonna go ahead and hit play here on the playlist. Here we go. Whoa. That was that was quite the journey. Awesome, thank you. Wow. Hey, I can't even say anything. That was wild. How you doing, Hayden?
So cool times.
How are you feeling post?
Feeling post, things get better by the minute. You can tell that I'm not fully back to where I want to be. It's very cloudy slash. Let me restart that again. Hold on. It's like, Hayden, I will murder you if you put these files on the internet. You have to keep these locked in the vault. You know, when you're like kind of coming online and you've been out there and then you're like coming back and you're like, how do I present myself, you know? When you come out of this, what you can, this is horrible. It's like the worst video footage ever. It's funny because there's like that fumbling time and it's like, here's the horrible and I'm like right here between the, okay, let me try again. Clearly. Well, obviously, I'm out of it still, but you just have to give yourself a little bit of grace and relax because you've been through a journey, you've been out there. It's funny because about every 60 seconds or so, I get 0.5% smarter. And so it's like, yeah, I'm like, oh, that's not as good as I'm getting better and better as this goes on. It's a pretty emotional journey that you go on when you're out there, and it just pulls you apart in a way that allows you to look at yourself from a slightly different angle. It's like Kevin sitting over here, and I can look at Kevin and I can say, oh, I can observe some of the things that are happening to this person, and I can see where the anxiety or the fear or the depression or whatever it is that comes up, you can see it. And then if you can see it, you can feel it. And if you can feel it, you can relate to it. And then once you kind of relate to it, you realize how silly it all is because it doesn't really matter. Nothing really matters. Like it just doesn't really, it lets you disconnect from this idea that you have to be anything but yourself. Like I just feel that some of what you realize while you're out there is that oftentimes you're your own worst enemy in a way, and you don't have to really be so hard on yourself. I think it allows you to say to yourself, like, okay, I can see myself externally. This is me being my own worst enemy, you know, in a way, which is like, I think obviously what a lot of people struggle with is being their harsh critic of themselves. So, hi, come on in.
How are you feeling?
That was quite the adventure.
How so?
It was fantastic. I mean, I went pretty far out there, and I think that these sessions that you and I have afterwards are always the hardest, right? Because like you just can't put into words what you're feeling. Is that common?
Yeah, and it's okay if you don't too, right? I always like to just focus on what did you feel, right? What did you see?
Yeah, so for me, I saw Hayden was in here with me and we were talking, and then the room started to get a little fuzzy. And then I could tell that there was some separation starting to happen. And I was like, okay, we got to go in. So I put the headphones on, put the mask on. And then from there, like a big pullback from reality. And rooms and expansive, space. And this is that moment where it's really hard to put it into words, but it's this idea that we tend to be our worst enemy, our own worst enemy, you know what I mean? Like oftentimes the internal judge and the internal cynical critic, yeah, exactly, is the person that is like beating you up. And when you can see that, and you can kind of like see that it's just so silly because you can just kind of like, when you can pull yourself back from it a bit, it helps you shed it. You know, it just helps you drop
It's like
it.
watching that happen to someone else.
Yes, exactly.
And so then you can have compassion for the whole process.
Yes.
For both yourself suffering it and yourself as the critic, right?
Thank you for talking, because I can't talk right now.
It's okay. The pressure's on.
No, but that's exactly right. I mean, it's because it puts you in this state, this dreamlike state. When you're out there, you just can have a little, if you can find a little compassion for yourself, and just say, it's okay. Like it's we don't have to. This is my journey, but for me, it's like we don't have to take ourselves so seriously. You know, like we don't have to. We can relax into this a little bit. Everything's going to be okay. You know, and it's like that release, I think, is probably what.
It's one thing to see that or to read it, to know that you should aim for that in your meditation practice. It's
Right.
another thing to actually feel the relief of it.
Right.
And that's what's really interesting about this medication. You can actually feel what it would be like if you let go of trying to hold on to life so strongly.
Right.
If you felt that lack of seriousness for a moment.
That's right. Yeah. So it's like, that's the tension, right? Because I think, especially with extremely driven people that want to achieve great things and they want to build and you also need to be able to let go. Because not everything is going to be a work.
And sometimes it doesn't matter if you hold on tight, right? Because you
Right.
don't control what you think you control.
Exactly.
So you might as well let go.
Yeah.
Right. Yeah. That's a great feeling. Did you have any emotions in the journey that you can recall?
I had an emotion of just feeling just at peace, I guess is the best way to put it. Just because I'm just like, everything's going to be okay. Everything's going to be okay. Because there's no other thing. It can't not be that way. It's hard
It's
to...
worked in. It's baked in.
It's baked in.
That it's going to be okay.
Yeah, exactly.
Yeah.
Yeah, because there's it's almost like once you let go and release, then there's no, if you can surrender to that, then it's like,
Right.
so it goes. So it goes, you know?
Yeah.
It's actually a great artist, the artist I love called Son. It's a song, So It Goes, and that's like one of the lyrics, and it's like, that's release like just waves just, so it goes.
Right.
It's nice, beautiful.
It's also nice to know that you're capable of feeling that way, that is a kind of a code or a program running underneath.
Yeah.
That you can access, that didn't come from outside.
Right.
You went inside and looked inside.
Right.
And saw that.
Yeah, and I'm curious, like, is that the realization that you see other patients have is when do they feel this like sense of like, oh, it's going to be okay.
Yeah, I think one of the most interesting things is when people say, I had your experience, what you felt, and I realized it was familiar. I've been here before.
I've been here before,
The
yeah.
topography of this piece is something I know, and I can access this, and I had just sort of forgotten, or it got cloudy with all the other things I put on top of it, right?
Yeah.
And also, just being for a moment outside of your own emotions is also just a relief to be able to see that your emotions aren't necessarily reality, right?
Yeah.
Just a kind of an information that your brain is getting. It's not the world.
That's right. Exactly right. Yeah. Yeah, you should just host my podcast now on, because I can't talk, so.
I usually host it on Ketamine.
Yeah.
That's the best one.
Yeah. But, I just think, obviously we'll start to wrap things up, but I just want to say, thank you for inviting me in here today and for giving me this little booster. And I intend to take it forward and go and, get some good positive neuroplasticity.
Yeah.
I'm not even gonna be able to say that. But I'm going to try and go and take it forward with, healthy habits of meditation and walking, exercise, and in post recovery, I think is a big piece of this.
It is. And in fact, there are some very interesting studies that have been done that show that if you do try to shape this the neuroplasticity in a positive way, a light neuroplasticity, if you will, that does result in a longer lasting remission of symptoms. So absolutely do that. Treat yourself the same way you would a very neuroplastic human being, like a child.
Right.
Right? So baby yourself, do all the good things, the affirmations, the antidepressant behaviors. Go forth and do good.
Amazing.
Okay?
Thank you so much.
You're welcome.
Okay, one last very important thought before we go. Whenever I speak with doctors or scientists or biohackers, they all more or less say the same thing, and that is if you're trying to improve your mood, the best thing you can do, without a doubt, is just exercise. Getting to the gym, even going for a walk outside. For me, I throw on a rucksack, which is like a weighted plates and a backpack. You burn extra calories and it helps with bone density, but it really, really just helps to get outside into nature. Also, listening to some of your favorite music can be a big boost. Sauna and cold plunge for me are also quite nice. And then meditation as well. I've had Henry Shookman on the podcast before. His app, The Way, is absolutely fantastic. You can find that at thewayapp.com. You get 30 days for free. Definitely check it out. Lastly, you'll notice that this episode was completely ad-free, and that's by design. I love not having advertisers on the show, but it is supported. There's some great members out there of our private community over at kevinrose.com. If you sign up there, you'll have access to our private chat, exclusive podcast episodes, articles, member discounts, and a whole lot more. It's really just actionable intelligence on emerging tech, financial markets. Obviously, we get into longevity research and peak performance. You can join the newsletter there for free and find out more details over at kevinrose.com. Thanks so much.